Hello, doctor.
Hello, sir. Do you have any health issues that prompted you to seek medical attention?
Doctor, for the past 2 weeks I've been feeling tired, with persistent fatigue that doesn't improve even after resting. I also have a loss of appetite. Food doesn't taste good, and I feel full quickly or bloated after eating. Could there be something wrong with my stomach, doctor?
So, have you lost any weight?
Yes, I've lost nearly 3 kilograms in the past 2 weeks.
Do you have any history of liver disease, or does anyone in your family have a history of hepatitis or liver cancer?
No one in my family has a history of hepatitis or liver cancer. I've had fatty liver disease for a long time.
All right, you'll need to undergo tests and screenings for liver disease and liver cancer. So, ladies and gentlemen, can you guess the results of the tests and examinations for the patient? After undergoing tests and an ultrasound, the patient was diagnosed with stage 1 liver cancer. Stage 1 means there's a small to centimeters tumor that has started invading blood vessels but hasn't spread beyond the liver. Vague symptoms like fatigue and loss of appetite begin to appear. The symptoms experienced by the patient are warning signs of liver cancer that are difficult to recognize, easily overlooked, and often mistaken for other conditions. Below, I will list these vague, easily ignored symptoms again. Fatigue. Fatigue is a feeling of persistent tiredness that doesn't improve with rest. This is a very general symptom often confused with stress or other conditions. Loss of appetite, lack of taste. Loss of appetite, lack of taste is a feeling of full quickly, bloated after eating small amounts or losing interest in food. Many might think this is a minor digestive issue. Unexplained weight loss. Unexplained weight loss is losing weight without changes in diet or exercise. This change may be gradual and subtle in the early stages. Indigestion, bloating. Indigestion, bloating is feeling of discomfort in the abdomen, bloating, or indigestion after meals. Like loss of appetite, these are common digestive symptoms. Mild pain or discomfort in the upper right abdomen. The liver area may feel heavy, uncomfortable, or have dull pain. Many overlook this or attribute it to muscle or digestive issues. Slight changes in skin or eyes. Very mild jaundice yellowing of the skin or eyes, which is hard to notice, especially in people with darker skin or in dim lighting. Itching. Unexplained skin itching, possibly due to bilirubin buildup in the blood. However, itching can also stem from other causes. Dark urine. Urine darker than usual may indicate elevated bilirubin but could also result from dehydration or other issues. Right shoulder pain. Sometimes liver cancer can cause pain radiating to the right shoulder due to irritation of nerves related to the diaphragm. This symptom is easily mistaken for musculoskeletal issues. Flu-like symptoms. Mild fever, chills, and fatigue may appear in the early stages and are easily confused with common infections. The case of the patient was diagnosed with stage 1 liver cancer. In very early stages, stage 0 and part of stage 1, patients typically do not exhibit clear symptoms. Symptoms usually appear when the tumor has grown to a certain size and begins to affect liver function or causes other impacts in the body. So, how many stages is liver cancer divided into? Stage 0 very early. The tumor is very small, has not invaded blood vessels, and has not spread. There are usually no symptoms. Stage 1 early. The tumor is small, may have invaded blood vessels, but has not spread beyond the liver. Vague symptoms such as fatigue or loss of appetite may begin to appear. Stage 2. Locally advanced. There are one or more tumors smaller than 5 centimeters, or a single larger tumor, still confined to the liver and may have invaded blood vessels. Symptoms may be slightly more noticeable. Stage 3 locally advanced. There are multiple tumors larger than 5 centimeters, or the tumor has invaded major blood vessels or nearby organs except the gallbladder. Symptoms are usually more pronounced. Stage 4. Metastatic. The cancer has spread to nearby lymph nodes or distant organs, for example, lungs, bones. Symptoms are often severe and depend on the site of metastasis. This is a composite image of the stages of liver cancer. As you know, liver cancer is one of the malignant diseases with an increasingly high number of cases leading to mortality. It is a condition where malignant tumors arise in the liver, destroying liver cells and impairing the normal function of this vital organ. The disease is increasingly affecting younger individuals, threatening the lives of millions if not detected early and treated with appropriate protocols. Although many risk factors for liver cancer are known, there is no complete and accurate information on how these factors transform a normal liver cell into a cancerous one. Some risk factors for liver cancer affect the DNA of liver cells, potentially leading to abnormal cell growth and cancer formation. Cancer may result from DNA changes, mutations that activate oncogenes or disable tumor suppressor genes. Chemical carcinogens, such as aflatoxins, have been proven to damage DNA in liver cells. Hepatitis viruses can also alter DNA as they spread within liver cells. Thus, liver cancer has multiple causes with various genes involved in tumor development. There are several factors can increase the risk of developing hepatocellular carcinoma (HCC). Gender. HCC is more common in men than in women. Chronic viral hepatitis. The most common risk factor for liver cancer is chronic hepatitis caused by hepatitis B virus HBV or hepatitis C virus HCV. Chronic hepatitis leads to cirrhosis, which can cause liver cancer. Individuals infected with both viruses have a higher risk of chronic hepatitis, cirrhosis, and liver cancer. This risk is even greater in heavy alcoholics consuming at least 6 drinks per day. Other viruses, such as hepatitis A and E, can cause hepatitis but do not progress to chronic hepatitis or cirrhosis and do not increase the risk of liver cancer. Cirrhosis. Cirrhosis is a condition where liver cells are destroyed and replaced by scar tissue. Individuals with cirrhosis have an increased risk of liver cancer. Non-alcoholic fatty liver disease. This condition is common in obese individuals. A subtype of this disease can lead to cirrhosis. Primary biliary cirrhosis. Certain autoimmune diseases affecting the liver can cause cirrhosis. Patients with primary biliary cirrhosis have a high risk of progressing to liver cancer. Inherited metabolic diseases. Individuals with hemochromatosis absorb excessive iron from food, which is deposited in soft tissues, including the liver. Excessive iron in the liver can lead to cirrhosis and liver cancer. Alcoholism. Excessive alcohol consumption is a leading cause of cirrhosis and increases the risk of liver cancer. Smoking. Smoking increases the risk of liver cancer. Former smokers have a lower risk than current smokers, but both groups have a higher risk than non-smokers. Obesity. Obesity increases the risk of developing liver cancer, possibly due to its association with fatty liver disease and cirrhosis. Type 2 diabetes. Type 2 diabetes is linked to an increased risk of liver cancer, particularly in patients with additional risk factors such as alcoholism or chronic hepatitis. Liver cancer is dangerous due to its potential to cause various complications. While it is not possible to completely prevent liver cancer, adhering to measures such as getting vaccinated against hepatitis B and C and undergoing regular screening can significantly reduce the risk of developing the disease. To learn more about preventing liver cancer, treatment options for each stage of liver cancer, nutrition for those undergoing treatment, and all essential knowledge about liver cancer, please follow my channel and check the link provided in the comments below. Patients experiencing the symptoms mentioned in this video should promptly seek medical attention for early detection and treatment of liver cancer. If you have any questions, feel free to leave a comment and I'll be happy to answer. Also, don't forget to subscribe to the channel for more helpful information. That's all for now. Bye.